Okay. So we'll go ahead and get started. Thank you everyone for being with us tonight. For those of you who may not know me, my name is Lauren Hockett. I'm a certified financial planner, and our goal at Hockett Financial Group in bringing these webinars to you is to take financial planning topics that we might cover in the course of working together and bring in an expert to do a really deep dive in a particular subject area. And if you have worked with me before or are working with me currently, you probably have heard me say before, you go through retirement one time. I help people navigate retirement all the time. And our speaker this evening, Heather Snover, helps people navigate Medicare all the time. She's bringing with her tonight almost 30 years of industry experience and the wisdom that comes along with helping people navigate this Medicare process to help shed some light on this, take away some of the confusion, and give you confidence and clarity as you enter into that process for yourself. And I'm going to turn it over to her in just a moment here, but before I do that, I wanted to be sure to let everyone know that if you have a question, there will be a question and answer portion at the end, which Heather will talk about in just a moment. But I invite you to submit your questions to us via email, and you can send those to me at lauren@hockett.com. And without any further ado, I will turn it over to Heather Snover. Heather, thank you for being here.
Yes, thank you, Lauren. I appreciate the invitation and be able to talk to everybody that's joining us tonight for this sometimes confusing conversation called Medicare. So I did want to let everybody know that this is for educational purposes only. This is not a sales presentation, so I will not be going over plan specific information. Again, it's going to be a very general and broad overview of Medicare. So if any questions do come in at the question answer section, I will not be able to answer plan specific questions for you, or maybe specific questions that are personal to your situation. So again, we're going to keep it very broad. And if for some reason I was not able to answer your question, you will be able to reach out to Lauren to get my contact information so we can set it up and be able to answer those questions as needed. I was hopeful in that we could do the presentation. I could turn the video off so you could focus on the slides, but I'm not sure if we're going to be able to accommodate that. So hopefully it's not a big distraction for you guys. All right, so these are the items that we are going to cover today, and we are going to do a brief overview of Social Security, who participates, and how Medicare works together with the Social Security. Turning 65 and still working, that is a big item that comes up in topic for me and my clients, because not everybody wants to retire at 65. Sometimes they'll wait to retire at 67. So we will talk about that. And we will talk about the Medicare 101, just understanding what your options are. I like to call it the alphabet soup, because we are going to be going through a lot of the alphabet letters today. It can be a quite confusing topic. I would encourage you to take copious notes. I always tell my clients when they meet with me the first time, it's probably going to take 2 or 3 times for it to all sink in, and it still might be confusing. That's all very, very normal. I will be repeating myself on some of these topics just because sometimes repetition kind of helps it go into our brains. We're going to be talking about whether we want to go through the federal original Medicare or if we want to go through a private carrier. We are going to talk about dual special needs plans. We're going to talk about prescription drug plans, Medicare supplement plans, and how to get started and when to enroll. So lots of topics today that we're going to talk about. All right. I'm going to put my eyes on to be a little bit more friendly for me. So Medicare coordinates with the Social Security office, and Social Security determines who is going to be eligible for Medicare. And they do some of the administrative work for Medicare. Medicare is available to people that are age 65 years young. And sometimes younger people with disabilities can join Medicare early. For instance, I have a niece, and unfortunately, she went legally blind about 4 years ago. So at the age of 30, she is already on Medicare herself. So if somebody's disabled and they are disabled for 24 months or longer, on their 25th month, Social Security is automatically going to enroll them into Medicare. You must be a U.S. citizen or here as a legal resident to qualify. Next question I get a lot, how much is this going to cost me? So the good news is if you have worked 40 quarters, 10 years full time, your Part A, which is the hospital, you have paid into Medicare, and there would not be a cost for that piece of it. If you're a stay-at-home spouse and your spouse worked and qualified those 40 quarters, you still get to earn that and not pay for that Part A. If you did work less than those 40 quarters, let's say you worked 30 quarters, you would have a small fee to sign up for that. And we'll go through this. Part B, as you can see on the screen, the least that you would pay for your Part B, which is your doctor, your outpatient, is $170.10 this year. And that changes yearly on an annual basis. The price before that last year was $146.50. So you can kind of see we did have an increase. The highest that you would pay for your Part B is at the bottom of this sheet, and it would be $578.30. So you can see what happens is you have the opportunity to look at how much you earned on your taxes, whether you filed individual or joint or married separate. And then depending on your earnings, you would pay your fee. So this is commonly referred to as the IRMA charge. So it's an income related monthly adjusted amount. And there is a 2-year look back. So right now in 2022, they would be pulling your IRS records for 2020 and be basing it off of that. So now the question begs, okay, well, I'm working. I might be making, let's make up a number and say I'm making $250,000 while I'm working, but I'm going to retire and I'm going to lose that salary. So it's going to go down significantly. You do have the right to file an appeal. So say you get your IRMA bill in the mail and you're paying $340.20. Now all of a sudden you're retired and you're on retirement Social Security only. So you would then file an appeal for them to look at, can you pay that $170.10 versus that $340. So, all right, so Social Security and what it covers. So again, we talked about a little bit of the alphabet soup. So Part A is going to be your hospital, and that helps pay for inpatient care, hospital, limited skilled nursing facility, and can pay for some home health care and some hospice. And again, if you worked your 40 quarters, 10 years full time, there would be no charge for that. You've already paid into it. Part B is what you would sign up for, and that covers your doctors, other healthcare providers, outpatient care, home health care, some durable medical equipment, and some preventative services. So the next question is usually, should you enroll in Medicare while you're still working? The answer is going to be yes. You always want to enroll in your Part A for sure. And then there are some questions to be answered if you want to enroll in your Part B if you are still working. Some of that is going to depend on a few different factors. One, you should check with your HR department at your employer because it does determine if by group size. So how large is your company? The other things that you might want to consider would be your income. Are you going to have those IRMAA charges? How much is your company contributing to your health plan right now? And do you have a spouse that's on the company benefits? Because a lot of carriers will not allow you to leave the plan and then have your spouse be on the plan. So lots of things to consider. You definitely want to enroll and sign up when you become first eligible, because if not, with both of these, the Part B, you can see, has a penalty if you don't sign up when you're first eligible. And it is 10% for each year that it is delayed, and that penalty never goes away. So we are going to talk and get into the alphabets and go ahead and give a brief explanation of what each of these means. Original Medicare, which is the Medicare through the government, your red, white, and blue card, consists of just two parts. So it is the hospital, which is again Part A, and your doctors and outpatient services, which is your hospital. So that is Original Medicare. Then you have Part C. Part C means going to a private medical carrier, and they typically will cover Part A, the hospital, Part B, the doctor, and Part D, which is the drug. And I apologize, my slides are skipping automatically, so I am trying to go back. So again, Part D is the prescription drug plan. Now, Original Medicare only covers the hospital, which is the Part A, and the Part B, which is the doctors. It only covers 80% of the costs. So there is a lot of reasons why people want to supplement. You can go for the Part C, and that is again going with that private carrier. And a lot of those plans include not only the Part A and the Part B, but they also include some extra additional benefits like dental, eye care, vision, wellness. And Original Medicare does not cover dental, nor vision, nor hearing. So that can be a nice to have to add. And then purchase a Part D plan. Sometimes it's included in your Part C with that private carrier. And if you stay with Original Medicare, you would need to purchase a Part D plan, which we are going to talk about a little bit later in the slides. So we have Part A and Part B. That's what the government pays for. Can you rely on that? Again, we talked about Part A and Part B. Part A covers the hospital, and Part B has the doctors, but only 80% of your costs are covered. And there is no maximum out of pocket like we have that safety net on our employment plans now. It does cover some prescription drugs, but again, you need to have that separate prescription drug plan as we discussed. The only items that might be considered paying from Original Medicare would be, let's say, for instance, you were having surgery and they had to give you some anesthesia there, or you might need nebulizer. It's a very, very, very tiny list of things that would be covered by Original Medicare on the drug part. So when you choose to go with that private carrier and separate from Original Medicare, that private carrier, again, takes over everything. They just tell Medicare, we got it. We're going to handle the hospital. We're going to handle the doctors. We're going to give them the drug prescription plan included in it. We're going to give them some additional benefits of dental, hearing, and maybe some vision. And we're going to give them a maximum out of pocket that they will pay for a calendar year. So unlike Original Medicare, you have no cap or limit on what your out-of-pocket cost would be. Going through the private carrier, they put that maximum out-of-pocket for the calendar year. So gives you peace of mind for sure. So there are plenty of options. How do I make my decision? And sometimes I have a client just be overwhelmed and say, I don't know, what do I choose? And it has to be a very in-depth conversation. And I know as we're turning 65, a lot of times our friends, our family are the first to say, I went with so-and-so carrier and I have this plan and it's the best and you should have it. You're going to get a lot of information and feedback, which is great. Just take it all in, be a sponge and soak it all in. But there needs to be a very thorough needs analysis done and what may be appropriate and right for you. So some things to take into consideration when you are choosing your plan. What monthly premium can I afford? Okay, if I go with original Medicare, I'm going to have 3 premium payments. I'm going to have a med sup plan. I'm going to have a prescription drug plan. I'm going to have to pay for my Part B. So what does the plan cover and the services that I need? Most important for my clients is bullet point number 3. Can I see the doctors I want? That is the biggest thing for clients. They want to be able to see that OBGYN specialist or that primary care doctor that they've seen for 20 plus years that knows all of their medical history. So we have to know, does my doctor accept the plan that I want to be in? Do you travel? That's a question that I ask my clients. And then I ask, do you travel foreign? Do you travel domestic? Both. Prescription drug plans. Again, we're going to talk about this a little bit later and get more into detail, but prescription drug plans really have to be looked at for the plan that you intend to go in. So you have 2 paths to choose from. You're at that crossroad. You can choose to do original Medicare and have your hospital and your Part B with original Medicare. You're going to then need to buy a prescription drug plan, and they're not going to pay the 20% likely with no maximum. So you're going to want to buy that supplement to fill the gaps that doesn't hurt. Or you're going to choose to do a Medicare Advantage plan with a private carrier, and you're going to let them take over your hospital Part A, your B, and your D, and you're going to get some of those added benefits. So if you choose to do that Medicare Advantage plan with the private carrier, you have 2 choices. So they're either going to offer you an HMO, which is a health maintenance organization. That's where you have to use a doctor that is in the network. You cannot go outside of the network unless it was an emergency. Of course, if it's an emergency, life or death, they're going to take you to the nearest hospital. They're going to stabilize you, and then they're going to get you over into that network hospital. You also will need a referral. So if you want to go see the cardiologist or the orthopedic specialist, you're going to have to get a referral from your primary care physician to do that. Now, with the preferred provider organization, that's a PPO, you can use a doctor or hospital in or outside of the network. But if you go outside of the network, you are going to have a higher share of cost that you're going to pay. These are some of the costs that Medicare Advantage plans cover for you on that private carrier. So they're going to pick up that Part A deductible hospital, which this year is $1,556. They're going to cover your co-insurance of your Part A in a skilled nursing facility days 21 through 100, which is $194.50 per day. After day 100, there is no coverage. You would need to have what's called a long-term care policy in place. They cover your Part B deductible, which is to see the doctor, durable medical equipment, and that deductible this year is $233. So they cover that for you. Plus they cover that 20% for the doctor visits. We talked about they throw in a lot of added benefits, dental, sometimes hearing, vision. They throw in that Part D prescription. There is emergency medical outside of the US, and they do put that maximum out-of-pocket limit. We're going to talk for just a minute about D-SNPs, and D-SNPs are a dual eligible special needs plan. And this is if anybody has low income that is maybe on Medi-Cal right now and would be going over to Medicare. Right now, Medi-Cal, it's Medicaid in other states, and in California, we're Medi-Cal, but they pick up primary. Once you switch to Medicare, then Medicare becomes the primary payer and the secondary payer is Medi-Cal. And again, there are certain income and asset to qualify for that. There are also chronic needs plans, which we're not going to go into today, but if somebody did have cardio issues, heart condition, diabetes, there are some what we call chronic needs plans that are available for them as well. Not to mention on those D-SNPs, they also may include some extra dental, Denti-Cal, eye exams, and sometimes even transportation to and from doctor appointments. Now, we've been putting off talking about prescription drugs. Let's dive into the Part D, which is the drug plans. So if you go the option of original Medicare, we said that you'd have to purchase a standalone prescription drug plan. Even if you're not on any medications now, would be very important to sign up for a plan, because if you have more than 63 days lacking of credible coverage, then that comes into gap, and you pay that penalty the minute you signed up for the rest of the time that you're on Medicare. If you go with the Medicare Advantage plan, it is likely already included. There are 4 stages in the prescription drug plan. My apologies that this slide keeps progressing forward. There are 4 stages to the prescription drug plan. The first one is your deductible. Right now, this year, that deductible is $480. Most of the time, the preferred generic and the generic, which are tier 1 and tier 2, are usually not subject to that $480 deductible. And there are some plans that do offer a 0 deductible. Stage 2 is you're going into the initial. So you've already paid your deductible. You had a drug that wasn't covered until you met that deductible. You pay that deductible, and now you go into initial coverage. And then you have a co-payment or a co-insurance, a percentage for the drugs that you purchase. And then once you reach $4,430, and again, this changes every year, this is what it is right now, you would enter what's called the coverage gap. Also, people may have heard it before, known as the donut hole. Back years ago, the donut hole, when you reached that gap coverage, you had to pay 100% of the drugs. Our government has negotiated that, and now they've reduced it to only 25%. So that's a big help for us. Once you and your plan have paid $7,050, that's a combination of you and the carrier, then you would go into what's called catastrophic coverage. And then the price of the prescription plans are reduced to only 5%. There is no cap, though, on that maximum out of pocket. So if you are on expensive drugs, it can be expensive. So formularies, I had talked about the importance of, yes, listen to friends and family advice, but every situation is unique and independent of itself, and especially because of the Part D. So we know we want to make sure your doctors are in the network, but it's very, very important for your insurance agent to know what drugs are you on so we can look up. Now, there is a formulary every year brought out by Medicare, and they're the most used and prescribed drugs. But that formulary can change throughout the year. And let's just say we have a carrier, and they have 5 plans that that carrier represents. Potentially all 5 of those plans could have a different formulary. So that's why it is very, very important to share all the information. Are you on a brand name drug? Do you take generic? We need to know the milligrams, how many times per day, so we can enter all that information and price out what is the best plan for you to be on, and keeping those drug costs as low as possible for you. Next, we're going to move on to supplements. So as we discussed earlier, all the ABCs, original Medicare covers, again, 80%. You have that 20%. That's a lot to cover sometimes. So a lot of people will get a MedSup or a Medigap plan. It's the same thing. It's just sometimes people call them different names, but they are the same thing. There are several different plans that are available to you. Keeping with that alphabet soup, they usually have letters. So they start from A and go to N. And those plans are sold by private companies and help cover the costs that original Medicare does not pick up. Since you'd be going original Medicare, you would have to purchase a separate drug plan. Now, the good thing about the Medigap or the MedSup plan is there is no network. So there's no in-network, no out-of-network. You can go to any doctor that you want to, as long as that doctor accepts original Medicare. So that would be the one question that you would want to ask your doctor, because not every doctor accepts original Medicare. Now, they might be on a Medicare Advantage plan, but that doesn't mean that they accept original Medicare. So you can go to anybody without seeing a referral. And if you travel domestically, you can go anywhere and use your MedSup. And then it does give you a little bit of foreign coverage as well. It usually covers 80% up to a maximum of $50,000 for foreign travel. So it gives you that freedom. So next steps, we're going to talk to and kind of bring it all together for you. And when do you enroll in your Part A and your Part B when you're eligible? And how far out should I wait to start this process? So right now we've kind of gone through all of those ABCs, and you have option plan 1, keep original Medicare, purchase that Medigap plan and purchase that drug plan. Or you have the opportunity to go to a private carrier and let them take over the Part A, the hospital, the Part B, the doctor, the drugs, and give you those added benefits. So those are the 2 roads that you have the option of traveling down, and you can discuss that with your agent. How do I enroll? Well, if you're going to collect Social Security, guess what? You're going to automatically be enrolled when you receive it. So that's great. If you decide you want to wait maybe till you're 67 and get a little bit more money, then you're going to have to sign up for Part A and Part B. And you're actually going to go to that socialsecurity.gov email address, or excuse me, the URL. And you can do that 3 months before you're getting ready to turn 65. If you worked for the railroad, you need to contact the Railroad Retirement Board and they'll sign you up. And again, anybody that's been on disability for 24 months, automatically you will be enrolled your 25th month. So if you do not enroll when you are supposed to, you may pay a penalty in the form of a higher premium. And again, you are going to pay that for the rest of the time that you're on Medicare. And you do have a 3-month window. So let's say you're turning 65 this month. You have the opportunity to enroll in a plan 3 months before your birthday, the month of your birthday, and 3 months after. So you have an entire 7-month window that you get to apply. If your birthday falls on the 1st of the month, let's say my birthday is November 1st, I would be able to enroll and start my effective Medicare on October 1st. So the first of the month, you get to start a month early. When you're enrolling in a Part C, which is the private carrier and the D plan, you again have that 7-month window that you can apply for your plan and start it. So again, 3 months after, 3 months before your birthday month and 3 months after. Are there other times that you can enroll? Yes. We're actually getting ready to come into it right now, and it is called AEP, Annual Enrollment Period, and that runs from October 15th to December 7th. So right now we are hearing all about the new plans, the changes for 2023. We cannot talk to clients until after October 1st, cannot see clients and accept enrollments until October 15th. But that is your time to change plans. So if you went into a health plan and maybe you weren't happy with it, that is your opportunity to change. You can also change your prescription drug plan during that time. So very important time of the year. All right, are there any other times? Yes, we call them special enrollment periods. So you might be moving, and because that move puts you into a new service area, that qualifies for you to enroll and change plans mid-year. You may have lost some income and need some extra help from the government, so that would be also a special enrollment period. Or maybe you're losing group coverage. Maybe you were 65 and you decided to work until you were 67 and now you'd like to retire. The minute you lose that group coverage, you can enroll in your Part B if you have not yet, and then you would have that special enrollment period. What if you are late signing up for Part D? I have had plenty of clients that weren't clients at the time and said, hey, I signed up for Medicare and I wasn't on any prescription drugs, so I didn't see the need to sign up for a plan, but now I'm on some medications and I would like to get some, help with a plan. Unfortunately, they had a lapse of more than 63 days without having credible drug coverage. And so they are going to face a late enrollment penalty. That penalty for every month that you were not in a plan. And again, that penalty stays there the whole time that you're on Medicare. There are a lot of prescription drug plans that don't cost a whole lot. So I always encourage a client to get the least expensive plan. So Medigap plans, when can you sign up for a Medigap? So the other Medicare private plan was 7 months. With Medigap or MedSup, you have a 6-month, and it starts the month that you're 65 and enrolled in Part B. So their example, you turn 65 on April 3rd, but you really don't sign up for your Part B until May 25th, and it's effective June. So your 6-month waiting starts from that period of time that you can enroll. Now, what if you delay? Going back to Medigap, usually the question is, I have some health issues. Can they deny me? When you're brand new to Medicare, there are no pre-existing health conditions. They can't ask you any underwriting questions. You can go into a Medigap plan and the carrier cannot refuse you. You would not pay a higher premium than your friend that's the same age as you because they're healthier than you. It's the same price. Now, if you are on disability, like my niece, and you're on prior to 65, you are automatically going to pay a higher premium on those MedSup plans. And that's given because you're on disability. But again, entering in, they cannot deny you the coverage for that. It's guaranteed issue, what we call. Now, what if you're delayed in enrolling in your Medigap? You had your 6 months, you missed your opportunity to enroll. Well, unfortunately, now it is not what we call guaranteed issue, guaranteed underwriting. So they will ask you a series of medical questions and it will be underwritten. If those medical questions are answered and you are approved, there may still be a penalty. And this penalty is you incur it from Medicare, not the carrier. So again, you have that opportunity to enroll in Medicare during your 7 month. You also have your annual change that you can do, which is October 15th to December 7th. I would encourage you to reach out to your local Medicare certified agent. Again, we are a heavily regulated industry, and right so, you know, we work with you guys, and we have to take a certification every single year. And with every single carrier that we are going to represent, we have to do a certification course. I can tell you it does not cost any additional money to use an agent. We have a predetermined price set by Medicare themselves of what we are compensated by those carriers. So it doesn't cost you anything additional. You can go do all the homework and do all the work yourself. Or you can use us. We do invest a lot of money into having software where we can look at multiple carriers at one time and put in your drug list. We can look up your providers to see, do they accept this plan? So I would encourage you to get a relationship with a local agent so you can make that determination of which is the best plan and which is the best route for you. I will warn you, during the time of you getting ready to enter in and age into the Medicare scene, you are going to be bombarded. You're going to be receiving emails. You're going to be receiving mailings. You're going to be receiving phone calls. And by the way, it is illegal for somebody to make an outbound call to you to discuss Medicare. Again, we are highly regulated. If that person reaching out to you has a relationship with you already, let's give you an example. You have a group plan or an individual plan with a carrier, and you're aging in. They absolutely have the right to outbound call you and say, hey, you're getting ready to age in. We want to go over the options with you. But if there is no relationship there, then nobody has the right to call you. You have to have what's called a permission to contact, and they have to, in order for me to meet with somebody face to face, I have to have what's called a scope of appointment form signed by you, and you mark what you want me to talk to you about, and you understand there's no obligation, but that we are going to sit down and have a sales presentation. I'm going to explain, we're going to go through plan details, plan specifics. So this is the part where I'm going to probably bring Lauren back on because this is the part of the questions. And again, I can't answer any specific questions. I apologize, but that's the rules and I follow the rules. But if you are interested in asking some general questions, I would be more than happy to answer those for you. So I'm going to go back to you, Lauren.
Perfect. Well, thank you for all of that. And like you said at the beginning, it can be very confusing. And I'll remind everyone listening, if this is your first time going through this, don't feel overwhelmed. Like Heather said, it is something you have to hear multiple times and get exposure to multiple times, probably before you feel pretty confident about it. We are recording this presentation this evening. So as soon as I have it available to share with you, I will do that. So you can go back and watch it again if that's helpful. And then obviously, I will be following up and sending you Heather's contact information, as well as some summary and key points from the presentation for you to take away with you, if that's helpful. I would invite anyone who does have questions right now, you can send them to my email still, lauren@hawkett.com. It's LAUREN at HAWEKOTTE.com. It's a great last name, except for when you have to convey it to someone in a situation like this. So sorry about that. In any case, we do have a couple of questions, Heather, that I will pose to you. And I don't know if it's something that you can't address. I'm happy to follow up with people afterward as well.
Sure.
One question here is regarding, and I'm not 100% sure exactly what they're asking, but HSA account. How does HSA account interplay with Medicare, or does it?
Yeah, good question, Lauren. So in general, we have HSA on the individual market and in the group market, and that stands for a health savings account. Those are tied with high deductible plans. And while we don't have that exact name in Medicare, they do have in Medicare what's called a Medicare savings account, which is essentially the same thing as an HSA. The deductible on that is just under $16,000 for 2023. So it is a very high deductible. It's not very common for people to enter into those MSAs, but it is available.
Okay, thank you. And someone is asking about moving out of the country, and can you postpone supplements, or are there things that people, I guess I will make this more broad and say, are there things that people need to think about or know if they're moving out of the country?
Yes, generally speaking, once you leave your service area and Medicare is notified, they immediately notify the carrier, and the carrier will send you a notification saying, we've heard that you've moved out of the service area. We are disenrolling you. There are certain situations, again, with keeping it very broad overview and not knowing specifics. There are certain plans that allow you to do what's called a visitor or a travel, like a 12-month kind of stay. And you could just call that carrier and have that discussion with them and say, I'm going to be going to Spain for 6 months and I'd like to be able to keep my plan. Is there a way to put it on hold? And then if you were going to be an expat, we actually are visiting our dear friends in Spain in a week because they retired there. They left Texas. And it's very common nowadays. So you can go ahead and put your Part B on hold. So you would want to reach out to Medicare Services and let them know you're leaving the country right now. Is there a way to put the Part B on hold? So in different certain scenarios, you can do that.
Okay, and I have a kind of an adjunct question to that. If someone isn't necessarily moving out of the country, but like in your case, if you're just traveling outside of the country but are covered by Medicare, does your coverage extend outside of the country? Is there should they look at other travel insurance, or what are the considerations there?
Great question. So some of the plans, like the MedSup, does give you 80% up to that 50,000 max. Not a whole lot of coverage, but it does give you. Some of the Medicare Advantage plans, certain carriers do give you very adequate, great coverage and foreign travel. And that's why it's one of my questions when I meet with my clients or my potential clients is, do you travel? Because there are plans that allow for it. If for some reason you chose a plan that was best for you that didn't have foreign travel, then I recommend people to purchase, and I represent them. It is called the Geo Blue Travel Plan. And actually, I purchased it for our trip for my husband and I. And just to give you a price point, my husband is 63, I'm 53. I purchased $1 million worth of coverage with a 0 deductible. We're going to be gone for about 11 days, and the price for both of us was only $143. So it's very, very inexpensive. It covers emergency dental, it covers prescriptions, it has certain COVID. It will pay you in addition to staying there. So there's a lot of benefit for a very, very tiny amount of price. So
that's really good to know. Thank you for sharing that. And let's see here. I've got, I think I have another one. Let me see if I might need to make this one a little more broad. For someone with a serious medical condition who might have really expensive treatment and care, based on what you shared, I think probably the main consideration would be that there is that 5% exposure to the drug costs that has no limit. Are there any other considerations that come into play in that scenario, or solutions outside of Medicare?
Yes. So if some times people will qualify for what we call low income subsidy assistance. And maybe not, they make too much for Medi-Cal and Medicaid, but with prescription drug costs, you might get relief with that plan. And then there is a state pharmaceutical plan that you can reach out to see if you can get additional help. And I have several clients that are on very, very expensive drugs. Excuse me. Sometimes you can work with the manufacturers. So usually with those clients, we go through all of the resources that are available to them to help reduce those costs, because they can be quite expensive.
And last one I have here, unless something else is coming in, is any information on coverage for acupuncture, homeopathy, and other adjunct therapies outside of traditional medicine?
Good question. So original Medicare actually does allow for acupuncture. It's not real robust. Off the top of my head, I believe they only allow up to 20 appointments, but you can ask for an exception to get more. They do not cover some of the reasons that you might get a referral to an acupuncture. And then there are some private plans. If you go with the Med Sup and you go with the Medicare Advantage, almost all of those plans offer chiropractic and acupuncture. So,
okay, great. Well, I think that covers all of the questions that we had, but as I mentioned, if questions occur to you after the fact, or there's something you didn't necessarily want asked in the form of the presentation, please feel free to reach out to me. I will follow up and share Heather's contact information with everyone should you be interested in reaching out and talking more specifics about your particular situation. And Heather, I can't thank you enough for doing such an amazing job succinctly and clearly describing this otherwise potentially complex topic of Medicare. And again, thank you so much. And
yeah, thank you, Lauren. I appreciate the invitation and the opportunity to talk to everybody. I love what I do. I love helping people, and it is very confusing. So I'm happy to help. Thank you.
Well, I can speak firsthand. You are, if there's one skill that you have, it is making things less confusing. So thank you again. And to everyone, thank you for being with us tonight, and be well.
Thank you. Bye-bye.
Bye.